My name is Benjamin Frazier. I'm a current ROP student representing San Bernardino County ROP. I'm an emergency medical responder class. My teacher's name is Ms. Boca Negra. My class is part of the health, science, medical, technology, industry sector. I took this class because I was interested in becoming a paramedic in the medical profession. I've learned to treat patients for shock, contusions, abrasions, lacerations, and to properly administer CPR. I go to college and become a EMS, and then soon after I'll become a paramedic a year later. The patient assessment is used to notify the ER at the hospital what they're expecting when the patient arrives at the hospital, and informs them of what to expect and what they are going to be dealing with once they get the patient. Today I'll be performing a patient assessment. This will consist from a head to toe assessment of the patient to look for any DCAP BTLS, which would be deformities, contusions, abrasions, punctures, penetrations, and lacerations to the body. Also, we'll be looking for PERLA, which will consist of pupil dilation, constriction, and any eye injuries to the body. And looking for circulation to the bodies from head to toe also, with the radial pulse and the pulse at the top of the foot. Look and feel the skull for DCAP BTLS. Look and feel the face for DCAP BTLS. Check for eye injuries and pupil response. Look for fluid in the ears. Check the mouth for any bleeding. Remove upper body clothing. Feel the pelvis for any DCAP BTLS. Comparable size of the upper extremity for any DCAP BTLS. Feel the lower legs for DCAP BTLS. Assess sensation and movement in the foot and pulse. Check the upper arms for any DCAP BTLS. Check the lower arms for any DCAP BTLS. Assess the radial pulse and sensation and movement. Roll the patient on his side. Check for any bleeding or DCAP BTLS.